Hi everybody, I'm Dr. Omar Hussain, PCN Clinical Director and GP at Milehouse Medical Practice, and today I'll be talking to you about the FIT test. So what is the FIT test? So FIT stands for Fecal Immunochemical Test. Breaking this down simply, it means it's a test that detects for very low levels of blood in the poo, often levels that you can't visibly see. And this is important because blood in the stool is not usually normal. It could be a sign of things like inflammation of the bowel or polyps, but it could also be a sign of bowel cancer. So it is a very useful and important test that we use both in general practice and in the hospital. Why is this important? So patients may go to see their GP for symptoms such as bleeding from the back passage or a change in their bowel habit. So that might mean constipation or diarrhea. They may also have unexplained abdominal pain or weight loss, or it may be that they've had some routine bloods done and the blood count is low, showing signs of anemia, particularly iron deficiency anemia. So the FIT test is very useful in these scenarios to see what else may be going on. How is the FIT test done? So normally the GP or the hospital order the test on the system, and then you get given this kit, which includes the FIT sample test here. It's got labels for you to put your name, time, date on there, so it's very important this gets labeled. And crudely put, you obviously need to, for example, line your toilet with some cling film or a clean bag, and you do the poop onto the bag. Or alternatively, you can find a plastic container that's clean, line that with some tissue, and try and do the poo into the container. You then open the FIT kit by just twisting it, and it has some grooves on the end, and you need to scrape the grooves into the poo so at least they're covered, and then you carefully twist it back into place. You pop this into the bag, follow the instructions in the letter that's given alongside the kit, and then you return that usually back to your GP surgery as soon as possible. In terms of what happens next, the results take 1 week, can be slightly longer, up to 2 weeks to go back to the requester, whether that's the hospital or the GP, who should then inform you of the results. Now, if the result is positive, it means you'll be referred on a fast track colorectal pathway to be seen very urgently in the hospital, who'll arrange a camera test, usually from the back passage. We call that a colonoscopy. Or they may do a CT scan, a very detailed scan of your tummy and your bowel, or they may decide to do both. If the test is negative, that can usually be reassuring, but it's very important to note that this is just a screening test and no test is 100%. So if you're still feeling unwell, you're still having symptoms that we can't explain or losing weight, then you must go back to the GP or the hospital doctor, who may decide to refer you or investigate or get a second opinion, irrespective of what your FIT test result shows. So in conclusion, it's a very useful test for screening for blood in the bowels. And if you have any further questions of how to do this or what kind of patients it's suitable for, please reach out to your local GP surgery or have a look at the bowel screening website online. Thank you for your time.